So, I'm very pleased to introduce our speaker for today. We have with us Jodi Steele, and Jodi has a kinesiology degree and a physiotherapy degree from McMaster University. She's co developed an oncology rehabilitation program titled Cancer Rehab the Next Step. And in 2005, her husband joined her, and together they founded Cancer Rehab Inc., Canada's first not for profit cancer rehabilitation center. And presently, Jodi has teamed up with Embrodia Academy to develop online courses for healthcare professionals and a mobile app for people with cancer. So I'm very pleased to have Jodi with us today for our presentation, and we'll pass it over to you, Jodi.
Thank you very much. And thank you to Wellspring for inviting me to speak today on my favorite topic ever, cancer. So for those of you in the audience that know me, they know that I love to exercise and I love to see people exercise because we know how many great benefits it has. So today I would like to share with you a few new things that have kind of happened in the world of cancer and oncology and exercise. So our first one that I wanted to do was tell you about maximum heart rate. So I know that a lot of people wear their Fitbit or their Garmin and they have apps on their phone to record their heart rate. But the question that always comes to mind is when they get that number, what does that mean to them? Like what do, they want to make sure that if their resting heart rate is 60 beats per minute, when they start to go for a walk, of course, that it increases. But what is the actual exercise formula or the formula for our maximum heart rate? And what are the parameters that we should be working in if, for example, we have a diagnosis of cancer? So I'd like to share that all with you today. And I know you're probably scared, but we're going to do some math. I say that to my students at Niagara College and they get terrified, but don't be scared. We're going to go through it very slow where we have a bunch of practice ones, and then we're going to get to your actual yourself so that you can leave today with your maximum heart rate as well as the target heart rate that's recommended for your particular age group and diagnosis of cancer. Okay, so first of all, the max heart rate, the old formula used to be 220 minus your age. And that we also can find max heart rate if you've ever had a stress test or a test done on a treadmill or a bike. And the physicians have you all plugged in and they can figure out your max heart rate either by exercise or through chemical induction. But of course, we're not going to do that on an everyday life. So instead, researchers have developed the max heart rate formula, which I said before was simple and 220 minus your age. But they recognize that it now can be even more intricately found out and sort of by using this new formula, it's closer to the reality of what we would see if the doctor had done it on a stress test. So if you look at this slide, it's the amount of beats that you have, your heart beats when you're at the maximum amount of beats you can for your particular age group. And that's maximum beats in 60 seconds. So the formula is 208 minus 0.7 times your age. And I will just tell you that we need to have those brackets in there. So if you have your phone or your calculator ready, we need to put the brackets in to make sure that you have you get the proper answer. So if you want to grab your phone or your calculator, if you're really good, you could do it on paper, but I would be impressed. So for the first one, Jennifer is 44 years old. So we're going to try to plug this into the calculator. So for myself, I'm going to put 208, subtract, then I put the bracket on, put 0.7 times her age at 44, and then end of bracket. When I press equal, has everyone done it? Give it a try. You should get the answer of 177.2. Now I'll tell you, you can't record your heart rate with any decimal points. So the rule of thumb is if it is 4 or less, we're going to round down 0.4 or less. So in this case, Jennifer's would be 177.2. So we would just call it 177 beats per minute. Of course, if it had been 0.5, we would have rounded hers up to 178. So watch that rounding. And not that, of course, your Fitbit and your Garmin and that is never going to pick up decimal points, but just so that there's no confusion. Okay. And so now that we have the max heart rate, what does that mean for us? We're basically not going to ever probably exercise in a max heart rate, but what we want to do is exercise in a target heart rate zone. And we want it to be a zone, meaning giving the person somewhere between like 136 beats per minute to 147 beats per minute. We never want to give anybody say you have to work out at 136 beats because it's impossible, for one, because there is some definite fluctuation. And yeah, you don't want to focus on that one number and not focus on your exercise. So we're going to give people a range. We're also going to give people a range because if you're new to exercise and you've just started out, you want to start in the lower range. And there's nothing wrong with doing that. And you start in the lower range, and as you become more fit, you can push yourself a little bit harder to work in the higher range. The interesting thing is, as you become more fit, you're going to be able to work harder, but be registered in a lower range, which is an excellent indication that you are becoming more healthy and your cardiovascular system is working better. So from all the research that we have with cancer and exercise, and there is a lot, and I started back in 2005 with my husband, I could pretty much carry the papers, there was not very many, less than 100 papers on cancer and exercise. But now here in 2021, we have thousands and thousands of papers written on what is the appropriate amount of exercise and type of exercise for people after a diagnosis with cancer. And the newest research has now said that we want to work at a moderate intensity. That's key. And moderate intensity would be expressed of 60 to 80% of your max heart rate. So if we want to get our calculators out again, let's try to find the lower limit of this example. So he's done his max heart rate, and he has a max heart rate of 170 beats per minute. Jim has just started, he just got a diagnosis with cancer, and he would like to start at the lower limit. He's going to find both his ranges, but we're going to find the lower limit. So all we do is transfer that percentage into a decimal point. Do you remember? I think that's grade 9 math. Who remembers? Oy, oy, oy. Anyway, so we're going to put in our calculators 170 beats times 0.6. And that is going to give Jim, he knows that when he starts to exercise, he wants to be working, his lower limit would be 102 beats. And the reason we give the lower limit is because if Jim is doing his 30 minutes of exercise, like walking the dog or doing something, and he's not reaching the 102 beats, then he's not in the moderate intensity. And the research has shown that as long as you're in the moderate intensity, you can have great results. Things like reduced cancer-related fatigue, reduced side effects and symptoms. And here's even the bigger one. If you work in the moderate intensity, they have shown that there is increased survival and a decreased chance of a reoccurrence of cancer. So these are big time. These are really important things, but it's important that you work in moderate intensity. So if Jim has gone for his walk, but his heart rate never goes over 90, then it's great that he went for a walk and that burned some calories and did some other great things, but it didn't do the things that the research has claimed to do for people with cancer. Does that make sense? Hopefully. Ask me questions later if it doesn't. Okay, so now let's take a second and just practice a few. So again, get your calculators out. And our next person is Joanne. So Joanne has a max heart rate of 186 beats per minute. And she's a middle of the road exerciser in the moderate intensity and wants to see what middle of the road is. So she's going to do an exertion level of 70%. So again, in your calculators, you pump in 186 times 0.7. I'm just doing it as well, make sure. And again, it's 130.2, but because 0.2 is lower than 0.4, we're going to round down. And so she needs to work at 130 beats per minute to get a 70% exertion. Okay. So again, let's try the next one. We're practicing. If anybody's having any problems, pop it in the question and answer. And we can see if I can answer those questions for you. Feel free to interrupt me. Let's try Timothy with a max heart rate of 193. He's a youngin', I guess, not a child, but a young person, times by 0.6 exertion level. And we are going to get, again, 115.8 beats per minute. But because it's 0.8, we're going to round up to 116 beats. Okay. Next, let's do Ashley. So again, 178 is her max heart rate, and she's going to, she's unwell, maybe in a hospital. We're only going to work her 0.5%, so times 0.5 to get a lower beats per minute. And you can see how that's lower when the exertion level is lower. And she is going to work at 89 beats per minute. Okay, so it's good to practice, but now the test of the time, we're going to do your target heart rate. So first of all, please get your paper and pencil, and hopefully you remember your age. I say that only because I've been telling everybody that I was 46 for the last year, and then I just realized this birthday I turned 46. Whoops. So hopefully you remember your age, and let's plug in to find your max heart rate. So it's 208 minus bracket 0.6 times your age. I'll give you a second to do that. It's hard for me to be quiet. For anyone who knows me, I don't like the silence. And remember, the max heart rate is really important because you should never, at this point, unless you've been instructed for some reason, which I can't fathom why, to reach that max heart rate, right? That's the ultimate upper limit of what you could. And then, of course, if you're listening today and you have a diagnosis of cancer, the research is suggesting that you work between 60 and 80% of your max heart rate. So let's plug your max heart rate in and times it by 0.6, and that will get your lower limit. Here, I'll do it, and then that way I'll be quiet. Oops. Remember to clear your screen. And then please find your upper limit. Okay, so I'm just writing it down for myself. And remember your decimal points. Okay, so remember your, so you should have some kind of range. I'm just going to do my second range. And so I have, and I can give you more time if you need, my range for my particular age group would be between 105 beats per minute, which would be 60% exertion, to 141. So that's a pretty good range. I have, if I'm not feeling well one day, or if I just had chemotherapy or radiation or one of the treatments, I would work at the lower range. And if I've been exercising a while, if I've joined the cancer exercise program here at Wellspring and I'm 12 weeks into it, I can certainly attempt to work at the higher limit, which would be the 80%. So hopefully you all have a good range. If you do not, or something didn't work out, please pop it in the question and answer, and I will help you out when we finish up this presentation. Okay, so now that we have a heart rate, we want to do the newest, another new form of, well, it's not a new form of exercise, but one that we're seeing more and more in our population of people with cancer is interval training. And what interval training means is that we're going to do some short bouts of more vigorous exercise, and then we're going to have those followed by longer intervals of more of a less stressful exercise. So you're going back and forth, back and forth, back and forth. And we know that interval training from the research is used to improve cardiovascular and respiratory health. And we know that there is some implications for people with cancer specifically. So interval training can be two different ways, and I'm going to show you. You can either do it all cardio. So this would be like if you went for a walk and you just started out walking, fair in your lower intensity. And then when you hit a telephone pole or something, you walked faster to the next telephone pole. And then when you got to that one, you'd walk slow. And so you'd walk fast, slow, fast, slow. That's one form of cardiovascular interval training. Okay. And the other kind would be if you did a little bit of cardio. So you went for a walk in the park, but you brought your band with you or your dumbbell, and you walked for 3 minutes in the park, and then you stopped and you did like bicep curl. Then you walked for another 3 minutes, and then maybe you stopped and did squats. So that's interval training with a cardiovascular and resistance training piece. So there's two different kinds, and both of those have shown to have many benefits, absolutely strengthening the heart. And we know that a lot of the treatments that we have for cancer, like radiation and chemotherapy and some of the immunotherapies do some damage to the heart. So we know interval training is one of the best ways to combat that and help to improve the heart muscle function. And we also know that interval training really helps us to have better oxygen delivery. So for those of you who may have had a drop in your blood work and your hemoglobin went down, this is a great way for the hemoglobin to rise back up and also to help the efficiency of the oxygen getting to your muscles. Okay. And also for anybody, if they had extreme weight gain during their cancer journey, we know that interval training is a great way to have weight loss. Okay, so a couple other things you may have heard out there, and this is pretty popular if you listen to the news or any fitness stations. There is one thing called HIIT training, and HIIT training is high intensity interval training. And this is when we really have really quite a bit higher. We work in that 80% or even higher situation when we're doing our exercise. Okay. And we know that HIIT training is, if you hear that, that's interval training. We know that HIIT training has really had a lot of benefits in the research for all age groups and all levels of fitness. So even if you feel like, oh my gosh, I've never worked out before, and you want to try some interval training, you absolutely can. And if your heart rate does jump up into the higher levels, it's okay. You would just do smaller intervals. So if you were walking on a treadmill, your long interval might be 3 minutes, your slower one, but maybe you only choose to walk quickly for 10 to 15 seconds. And then as you become more fit, you could increase those longer, the high intensity intervals. We also know that HIIT workouts there's been quite a few advantages for the older adults. So that would be people over 50 years old. And I think that people were kind of scared saying, oh, let's get older people to do this high intensity interval training. But if you are make sure that you are monitored by a physician or a physio or a personal trainer and you get it done correctly, that it's actually proven to be quite safe and lots of good results. And it's also to really, which is the key, has actually shown to build strength in seniors, like older adults. And at one point way back in the day, they didn't really think that seniors had an opportunity to increase or hypertrophy or get their muscles bigger. But we do see actually strength gains as well as increases in actual muscle mass in our older adults. Woo. So not only do you want to try to use your max heart rate, but there's some people in the population that are perhaps on medication that doesn't allow them to their heart rate to rise. So if you're on beta blockers and certain meds that keep your heart rates blunted, you won't be able to use the max heart rate formula. And instead, we want people to use rate of perceived exertion. Now, if you've ever been into a wellspring and you've been in the exercise area, you know that there is these charts posted everywhere. I love these charts. These are called Borg's rate of perceived exertion scale. And this is actually a good one if you don't have a Fitbit or you're not interested in using your heart rate. You can also use the rate of perceived exertion scale. And what this is a scale from 0 to 10, and it's how you actually feel. How tired are you? How difficult it is for you to breathe? How difficult, the talk test we say, can you actually form a sentence, or are you huffing and puffing and not able to get a sentence out? And so what we do is we ask you to exercise and then pick a number from 0 to 10. 0 being like you were asleep, and 10 being like you're at your maximum and you could only ask for a second. And we recommend, of course, that you, as a moderate intensity exerciser, we ask you to have your number between 4 and 6. Now, some people, this works really, really well in children. Children love to give you their number. They have no inhibitions. They just pick a number and they're very honest. But as adults, we sometimes think, oh, what's the right answer? There is no right answer. It's just how you feel on a scale from 0 to 10. And I'm sure that you've been asked this by your physician about your pain scale, right? So they probably said, how is your pain from 0 to 10? Exercise is the exact same. And you just pick the number that you feel is appropriate for you at that particular time. So again, if someone is just did a high intensity workout and they were on the treadmill running quite like at a quite good clip, they might tell me that their rate of perceived exertion is somewhere between 7 and 9. Okay. But again, the recommendations for people with a diagnosis of cancer is try to stay in between 4 and 6, which is known as the moderate intensity. Okay, so there's all kinds of great charts you can download from the internet, or you can carry one in your pocket. They have them in all different languages. I used to work in Scotland, and they have different, instead of these words, hard, really hard, they have fun Scottish words like peckish and peaked. It's very fun. So there's all kinds of cute ones. There's also ones with just pictures, like smiley faces, if that resonates more with you than numbers. Okay, so when you're exercising, you always want to check to make sure that you're in the heart rate range. Check to make sure that you are in the proper range for rate of perceived exertion, but also to not negate how you're actually feeling. So if you're exercising and one day, you're feeling any of these signs, you need to stop exercising and then either contact your physician, or if it's something that you're used to being a little bit dizzy, but then it goes away, then of course you need to have that rest period. So the big ones to be aware of course, are dizziness. That could be a drop in your blood pressure. And when you exercise, we really want your blood pressure to rise, not to fall. So that would maybe perhaps be an indication of something. Also, obviously, chest pain is an absolute stop. And if you have medication for that, to administer your medication, or of course, to make sure you refer yourself to the physician. Feeling more tired than usual. We don't push through that old saying of no pain, no gain. We don't believe that anymore. That's silly. So if you are feeling more tired than usual when you exercise, it would be time to discontinue exercise and perhaps again try the next day. If you're feeling anxiety towards your exercise or stress about that, again, to stop and consult your personal trainer or physiotherapist. And again, last but not least, if you have unusual muscle pains, cramps, aching, especially in the area in which you had surgery, but it could be anywhere. One on the side note is if you do have cramping, which can happen a lot for anybody, especially in the calves. If you've ever woken up in the middle of the night with a crazy calf cramp, sometimes that can be indicative of just being low in potassium. Again, you need to consult your physician. And we do see that cramping sometimes more in people who have had chemotherapy and treatments like that, because your electrolyte levels are set off by the chemo. So if that's the case, that would be a quick fix of contacting a dietitian and getting some recommendations for food with more potassium, or again, going to your physician and having some blood work done to see if that truly is the reason. Okay, but we make sure don't push through exercise. We never encourage that, and use your checklist for safety. Okay, so let's just take a second and talk about a couple workouts that you could do. So if this is the interval training I was talking about, that's purely cardiovascular. So again, let's call it the treadmill or the walking. I guess if you don't have a treadmill, this could be marching on the spot. This could be walking circles around your living room or doing laps of your living room. So the first thing you'd want to do is a slow pace walk to warm up. And people who are in the Olympics and big athletes, they tend to warm up between 3 to 5 minutes. But people after a diagnosis of cancer, we recommend that you warm up for at least 5 to 7 minutes. So this might be the most boring part of your workout, but hopefully you'll have some tunes rocking or somebody like me talking to you. And this is the time when you want your heart rate to go from the resting heart rate to just the beginning of your 60% of your max heart rate. So the warm up is not a time to go from, rest right up into your zone, but you want to gradually warm your muscles up and gradually get your heart rate to start to get close to that number in the zone. So my zone is 105 to 141 beats per minute. My resting heart rate is 60. So as I'm warming up in that 5 to 7 minute period, my resting heart rate at 60 beats per minute is going to gradually increase till I get to about 105 beats per minute. Once I'm in the zone, and I've done my warm up, and again, we also want to make sure that our muscles are warm and our body is warm, then I'm going to start my first interval. So the first interval is fast walking. So I'm going to time on my watch, or what I use? I use my cooking timer. I set that for 15 seconds, and I'm going to walk quickly. My heart rate is going to rise up into closer to my 80% range, and I'm going to try to maintain that for 15 seconds. Again, as long as my rate of perceived exertion is somewhere around 6 or maybe 7. Just as I'm starting to get tired, I'm going to come down for my slow walking interval, interval, or as some people call it, the rest interval. I'm going to do this for a longer period of time, so maybe 90 seconds, and just my heart rate's going to come down. The key to this is that the heart rate never drops below your what you found out to be your range. So my 90 seconds, I have to walk fast enough to stay in my range of 105 to 141. I don't want it to drop too low, because then I know I'm not working hard enough. And then I'm going to repeat this interval 6 times. So I'm going to go fast, slow, fast, slow. And for the first couple times, you're really going to be very conscious of your looking at your Fitbit all the time, maybe even jotting it down to see what your heart rate is. But after you've been doing this for a while, you will know if you're in the right zone or not. So you'll be able to feel, oh yes, I'm definitely working faster. I'm working hard enough to be in the higher zone. And now my rest is enough to catch my breath, to be able to talk, but I'm still staying in the zone. So I'm going to repeat that 6 times, which is probably going to take a good 15, 20 minutes. Then I'm going to finish my workout with a cool down. So again, that could be just standing one spot, sidestepping. And the idea of the cool down is to make sure that now your heart rate comes right back down to almost close to resting. So if my resting heart rate is 60 beats per minute, when I do my cool down, I'm watching my Fitbit or my app or whatever it is, that my heart rate is generally coming down. You should continue to move. So the worst thing you can do after exercise is plop yourself on the couch. Or I know you're probably tired, so you're like, I gotta sit down. But you want to stay up and moving, but at a very slow pace until the heart rate comes back down to close to resting. And then you could grab a drink of water and you're done for the day. And the reason we want to have a good cool down is we don't want to have pooling in the lower extremities. We also don't want to sit down really quickly and have a dramatic change in our blood pressure, because then you will feel dizzy or get a headache, or depending on what the situation is. So remember, cool down is equally important. And again, this workout probably takes about 30 minutes, which is an excellent time, because the recommendations for people with cancer is to exercise for 150 minutes per week. So if you break that down, that could be 30 minutes for 5 days a week. So every day you could do this 30-minute workout for 5 days. Or you can change it up. When you come to the cancer exercise program, we exercise for 45 minutes twice a week. So that's 90. And then you only have to work out another time to get your 150 minutes. So again, it doesn't matter what combination of exercise you do, as long as you try to reach 150 minutes per week in the moderate intensity. Whew. Okay, now, if you are more of a weight trainer, and again, the recommendations are for people to do a little bit of weight training and a little bit of cardio, you have to remember that as soon as we add dumbbells or tubing or balls or that kind of thing, you have to really make sure that safety is your utmost importance. So, have to have a clear space. Now that we're trapped in our houses, make sure that you have a clear area, no animals running around, nowhere that you're going to trip. And make sure that you have weights that are sufficient for what you're going to be doing. So there is no harm in starting out with 1 pound or 2 pound weights. Or if you don't feel like purchasing that, well, we could use a jar of peanut butter. We could use a water bottle, just to have a little bit of resistance against your muscles. Okay. And the great part about adding the resistance training instead of it just being cardio is that we know that from the research, this has a better increasing in muscle mass, which indirectly will reduce your fat stores. So better fat loss when you do this kind of interval training. It definitely burns more calories, again, because the more muscle you have, the more calories you burn. So we're using the resistance training to build more muscle. We also know that there is a direct correlation in lowering blood pressure with this kind of resistance or interval training. And we do see some increasing in the good cholesterol and decreases in the bad cholesterol or triglycerides. Okay, so how this would look, here's just a little example. Again, you would warm up. So you're going to walk around the house or do whatever it is you do, sidestep, marching, I don't know, do a little dance, some Zumba. And you would warm up for 5 to 7 minutes until your heart rate is reaching the bottom level of your interval, of your range. And then what you're going to do is you're going to go back and forth from using some kind of strength training to some kind of cardio. So in this example, we might use 3-pound dumbbells and do 10 repetitions of dumbbell curl. I should have put a picture of that actually, but I think that you can probably Google and find out what a bicep curls. Then you're going to switch over to the second interval and you're going to do cardio. So you're going to walk around the house for 3 minutes, making sure that you're in your moderate intensity range. Then when we're done that 3 minutes, we're going to immediately go to dumbbell shoulder press. And that's the one that you press over your head. If you like that one, if you could do that one, again, these exercises, there's thousands of different exercises you can do. So you might do 10 reps of that. Then you're going to go back to your walking. So those are some upper body one. And then if you would like to do some lower body strength training, you may choose to do some squats. And that would, if you don't know what a squat is, you can Google it. I'm not going to demonstrate that one. And then again, back to walking. And then lastly, you could do calf raises. So in this training, you've actually really been able to do a lot of different muscle groups. And I like this one because it's kind of a trick. So you feel like you're getting tired and short of breath and not able to talk during the cardio portion, but you actually think that you're getting a bit of a rest when you're doing the resistance training, even though you're not really resting, because if you watch your Fitbit or your heart rate, you will see that your heart rate in this particular training stays in the moderate intensity quite nicely and the whole time. So even though you feel like you're getting a rest when you're resistance training, you're actually maintaining yourself in the range. Okay, I think that's enough talking for me. I think that this would be a great time to send it on over to see if we have any questions.
Thank you so much, Jodi, for that presentation. That